The emergency room here at Morris General Hospital south of Winnipeg closed indefinitely in 2023. And for people here, healthcare is top of mind this federal election.
You can go there with somebody half dying and all it's got is a thing on the door, the emergency's closed.
I think it would all come down to accessibility. How easy is it to obtain that health care?
Megan Adams lives with multiple sclerosis, but it was her son's allergic reaction to kiwi that made not having a local ER frightening.
When your son's life is being threatened and you have no choice but to call an ambulance and take your son on a 45-minute drive, it can be pretty problematic.
Nipawa family doctor Nichelle Desailly knows patients are traveling further and longer for health care. She hopes rural health care is a priority this election.
I know that there's a lot of people that are stressed over economic concerns, over tariffs from the United States, but we can't let healthcare fall too low on the priority list. That has to stay at the top.
I work in the emergency room.
Desailly is trying to convince these medical students to work in northern and rural areas. As of 2023, Doctors Manitoba says the province needs about 346 more doctors to meet the national average. It's a pattern of healthcare staffing shortages that's especially playing out in rural areas.
I think it's in a crisis.
The Society of Rural Physicians of Canada is calling on all federal parties to commit to creating a national rural health workforce strategy, funding a skills training program so northern and rural doctors can broaden and cater their skills to the community, and making it easier for physicians to practice across provinces.
One of the major reasons why physicians leave rural areas is they just don't feel that their skill set is meeting the demands of the community.
The Society says rural health care will only get worse without a strategy, leading to even more burnout, poorer health outcomes, and more pressures on healthcare facilities in urban centers.
We have an opportunity to focus on how we support and stabilize rural health services, and that will make it more appealing for people to work here.
For Eileen Klassen, people in Morris deserve a better hospital with more services.
It makes me very worried since I had that stroke.
At 78, she isn't going to move now. She hopes the conversation on healthcare doesn't forget rural towns like hers. Rosanna Hempel, CBC News, Morris.